Thank you, Peter, and thanks for welcoming us back to Nepean Hospital and Dr. Nguyen. This is a phenomenal announcement today at the opening of this next stage of the hospital here in Nepean. It's a game changer for Western Sydney. Just going on the tour earlier, the new birthing suites, 200 additional beds, it will make a real difference, not just to the people of Western Sydney today, but for generations to come. And as a former treasurer, I was commenting to the health minister earlier that we make these decisions. We've managed the finances here in New South Wales incredibly well. To be able, years ago, to make the decisions in the budget, $1 billion investment here in Western Sydney, in the heart of Western Sydney, which will make a real difference to the healthcare of people in the West. As I said, it's an absolute game changer. It'll make a real difference to people's lives. We want Western Sydney to be the best place to live, to work, to run a business, to raise a family for years and years to come. And making these investments and being able to go through the tour today, I want to thank Dr. Nguyen and all the doctors and the clinicians here at Nepean Hospital. They have provided substantial input in terms of the design, in terms of the works that have occurred here. It's been done in partnership with the local community, with patients in terms of the care and the support they need. And just going through the hospital today, I know that this will make a real difference to people's lives. Since 2011, this government has built 170 new health facilities and upgraded health facilities across our state. We have 110 more in the pipeline. Now they are big numbers, but behind those numbers are people, are patients who deserve the very best healthcare. And this is a government that has put healthcare front and centre since coming to office. You don't make these financial allocations and build these hospitals overnight. They take time, they take a dedicated team, but to see this become a reality today is incredibly pleasing for me as Premier. I particularly want to thank Health Infrastructure and the contractors and subcontractors who have worked on this project, close to 4,000 people. And we know, particularly during the last 2 years, that construction has been the driving force of economic growth and jobs growth in this state. And that started before the pandemic. I often say that it's not how you manage the state's finances, how you manage the budget in the good times sets you up for the challenging and difficult times that come our way. And New South Wales came into this pandemic in a very strong position because of the significant infrastructure investment we made. We turned around the state's finances. We invested in schools and hospitals and road and public transport, which has driven economic growth, but ultimately at the end of it will make a real difference to people's lives for generations to come. So I want to particularly thank all the workers, there's close to 4,000 workers and subcontractors who have been on site over the last 2 years. You couldn't be building a hospital in a more challenging time, but this hospital is being built on time and on budget. $1 billion investment for the people of Western Sydney. We had many people come the other day for the open day, 300 people came through, and it was great for them to see firsthand the new facilities, the state-of-the-art technology, the equipment that will make a real difference. And Dr. Nguyen was saying earlier, just this new equipment, the patient journey will make a real difference to people's lives. So it's an incredibly impressive hospital. I'm very pleased as Premier to be here today for the official opening. I want to thank the local member and Minister, Stuart Ayres, for his advocacy. No one is more passionate about Western Sydney than Stuart Ayres, and I know, and he'll speak to this, about how important this hospital will be in making a real difference to people's lives here in the West. I want to thank the Health Minister. I remember many debates in my former role as Treasurer as we headed into the budget when all he wanted was billions and billions of dollars for health infrastructure. Brad always won those debates, and today we can see the benefit of his strength as a Health Minister and the entire team here in New South Wales Health, who have done an amazing job and will continue to do so once this hospital opens and progressively opens from May. Finally, I just want to, obviously Dr. Chant is here as well, and she will speak shortly in relation to some changes we're making today in respect of COVID. But before I make comment there, what I'd like to do is thank the people of our great state. It has been a very difficult 2 years, and people have made enormous sacrifices and efforts to ensure we've kept people safe during this pandemic. And I know there can be a sense of negativity from time to time, but if we take a step back and look at New South Wales compared to anywhere else in the world, when it comes to our healthcare success, the fact that we've been able to have such a high vaccination rate of above 95% double dose, that has taken effort and sacrifice from many people across our state and has put us in a good position. It put us in a position, whether it was through Alpha, Delta and Omicron, to open up and stay open as much as possible. And that kept people in jobs, that kept people in business. I was with Minister Ayres this morning, speaking to many local business owners here in Penrith, and they spoke about the importance of staying open. They spoke about the importance of the fact that they were able to keep their cafes or the other businesses and restaurants that they ran. And it's a hidden thing that it's not spoken about, but they were able to stay in business because we had a very strong health response in this state. Now, I want to emphasise that obviously the pandemic is not over. There is a long way to go. But today we've made changes in consultation with the business community, with union representatives, and because of the efforts that everyone has made, we're able today to make some further changes. They'll be outlined further by Dr. Chant and Minister Hazzard, probably to some degree. But those changes today will include the removal of close contacts, removal of the 7-day isolation period for close contacts. In addition, today we will be moving towards removing hotel quarantine here in our state. Hotel quarantine has proven to be incredibly successful over the course of the pandemic, but from this position that we're in now, hotel quarantine will cease. In addition, we'll also be moving from a government perspective in relation to mandates to a occupational health and safety approach. All areas of government will take risk-based assessments in relation to their areas of employment, and they will make recommendations in relation to where vaccination will be required in their specific areas. So, for example, and Dr. Chant will speak to this, there'll be certain areas in health where vaccination will be required, just like we've had pre-pandemic for various health workers in certain settings. In addition to that as well, today we're announcing that green dots will be removed from public transport. So I want to make the point in closing. This is not the end of the pandemic. We will always tailor our restrictions, as we've said from the outset over the last 2 years, to the circumstances that we find ourselves in. But today is a day where the people of our state in New South Wales can be incredibly proud. To be in a position, we've had an incredibly low death rate. We've had we had downward pressure on our health system. And that has been because of the efforts and sacrifice that people have made. Yes, governments tailor settings. Yes, government make decisions. And for the course of the last 2 years, it's been numerous decisions and numerous steps that we've had to take to keep our people safe, to keep people in work, to keep business in business. But overall, the balance that we've been able to strike here in our state, I believe, has led not just the country, but has led the world. And that's not on the back of the government. That's on the back of the great people of New South Wales, for the efforts and sacrifices that they have made. That's what's kept our state strong, and that's what will keep our state strong even more as we head into the future. So I'm now going to pass to Minister Hazzard, who will speak to this great new hospital here in Western Sydney. Minister Ayres will then speak as well. Then Dr. Nguyen from a clinician perspective and what this means to our doctors, our nurses, all our staff, our allied health professionals who will work here at Nepean Hospital, and then Dr. Chant will give a public health update. Thank you.